Hello everyone, my name is Jorden Gershon, and for our fifth and final presentation, I will be informing you about the role of a music therapist. I have prepared a presentation called Healing Through Sound, where I will explain what a music therapist does, the qualifications it takes to be one, and its rise and addiction recovery settings. Imagine healing in a new way. Imagine being able to overcome trauma, addiction, anxiety, PTSD, OCD, you name it. And we can do this not just verbally, but with frequencies, harmony, music therapy. One of the largest music therapy nonprofits in the world, the American Music Therapy Association, defines music therapy as an established health profession where music is used as a primary medium within a therapeutic setting to address physical, emotional, cognitive, and social needs of individuals struggling with issues such as anxiety, addiction, trauma, PTSD. This comes directly from the American Music Therapy Association. There's three main points I will go over in this slide today. First being the role and the history of a music therapist. Secondly, the education, the certification, and the career outlook of a music therapist. And three, the rise of music therapy and its importance in addiction recovery settings. So I'd like to begin with the role and history of music therapy. So first let's start with two simple terms. We have therapeutic communication and nonverbal communication. Therapeutic communication refers to any kind of communication that is being used to help someone address a problem, whether it's physical or mental. So think therapy, psychology, any of that. Nonverbal communication achieves the same goal, but it doesn't require you to use words. So again, we can use a medium such as music therapy in conjunction with therapeutic communication. The main services that a music therapist provides is support for emotional expression, behavioral issues and changes, improving cognitive function, reducing anxiety, reducing PTSD, and overall giving a patient a new thing to engage with. So in the very late days, music therapy began to be an avenue to help veterans with PTSD. It then began to work with various populations of children with autism, elderly people with dementia, recovering addicts, and people who struggle with anxiety, general PTSD, OCD, things like that. So from the VA Northport healthcare system, they say in 1945 that the War Department Technical Bulletin detailed an official program on the use of music for reconditioning war veterans in Army hospitals. So they used music therapy as a medium to help the veterans recover from PTSD, from war. So what it is a client-based music intervention that is used in clinical settings, paired typically with a licensed music therapist. Yes, you can perform music therapy without being licensed, but a traditional one would be licensed and has a certain certification with a psychology degree or a BA in psychology. So the main mediums used are singing, songwriting, drumming, improvising music, allowing patients to explore music, or deeply listening to music for therapeutic reasons. Secondly, I'd like to talk about the path to becoming a music therapist. The first step, and the most important in my opinion, is building relationships by understanding the psychological and neurological principles of your patients, simply understanding why they are there. This brings me to a term from our public speaking textbook called empathetic listening, which refers to the literal meaning of why a person feels the way that they do. This is very important in music therapy because typically when people seek music therapy, it's because they may not be able to verbally express the issues or maybe verbally discuss what's going on. So music becomes that medium and that outlet for them to express some of those emotions and work through them. So for schooling, it starts with usually a bachelor's degree in music therapy or a BA in music with a minor or a specialty in inclusive education. Right now at UCCS, I'm a BI major in music with a focus in inclusive education, which will allow me to practice as a music therapist. You can then try clinical internships if that's interesting to you. You can go to graduate school to get your official certification for becoming a music therapist. And the highest level of music therapy you can achieve is becoming a board-certified music therapist. The beginning salary for a music therapist starts around $54,000 a year, depending on the demand, the specialty, and what kind of practice you do. The salary, of course, can increase, especially if you're a board-certified music therapist. You could be making around $100,000 a year or more. Lastly, and most importantly to me, I would like to talk about the relevancy of music therapy in addiction recovery settings. Why does it work in addiction recovery settings? One, it helps clients express trauma and emotions non-verbally. As I mentioned previously, some things such as PTSD are too difficult for patients to verbally communicate in a therapeutic setting. It provides healthy and alternative structures to traditional therapy. Support groups provide cohesion and help people rebuild their identity, and getting involved with volunteering at addiction clinics, music therapy workshops, and interning at recovery centers help patients find a sense of purpose in their life. A real-life example is from the Harmony Foundation in Colorado. This was built by Bob Dean, who provided a sanctuary for individuals such as himself recovering from alcoholism. This is an accredited rehabilitation facility in Colorado that allows for patients to come in for detoxing, and they use music therapy as a primary resource and medium to help patients increase their length of sobriety and overall success rate. In conclusion, music therapy is an exciting and involving career, especially impactful for people with disabilities or for people who are in recovery environments. As we continue to face mental health and addiction crises, music therapy offers a fantastic alternative to treatment and also for transforming lives. If you have ever been touched by music, imagine how it could help someone else. Imagine how it could help someone rediscover their identity. Thank you so much for listening to my presentation. I hope you learned something new, and I'm excited to hear your thoughts. Have a wonderful day.